Okay, so I can just see we're at almost 30 people in the chat and a few people still coming in. So we might kick off. Just to say welcome everybody. My name is Dan Rogers, Head of Education in Tangent, Trinity's Ideas Workspace. So that is the Innovation Entrepreneurship Hub at Trinity College. We're delivering a Postgraduate Certificate in Healthcare Innovation in partnership with the School of Medicine. And that program will be running at the end of March, be kicking off the end of March this year. And we're going to have a fantastic panel discussion this evening. I'll introduce you to some of the panel in a moment. So this is a discussion. It's also a Q&A. If there are any particular questions around the Healthcare Innovation course, feel free to ask them in the chat. I'll be manning the chat during the session, and I'll answer any related questions that anyone may have. So without further ado, I'd like to introduce you to this evening's panel. So we have Tanya McGrath, who is Head of Product Innovation at Novartis and also a former student of the PG Cert in Healthcare Innovation. So welcome, Tara. Delighted to have you here this evening. We have Maria McCann, who's Director of the Health Identifier Service in the HSE. We have Tanya Mulcahy, who's Director of Health Innovation Hub Ireland. And also we have Professor Dan Maher, who is from the School of Medicine at Trinity College. So Dan is going to chair the discussion this evening. Dan will be the man asking the questions, and I'll be fielding questions from the chat, which I will feed through to Dan and onto the panel. So very welcome to all our panel this evening, and really looking forward to lively discussion. So I'll hand over to you, Dan, to kick off from there, please.
Well, thank you, Dan. Thank you very much. And in fact, you can act as a timekeeper there in the background as well, Dan, because we could stew off because we've got a very exciting evening. We've got a tremendous panel here with a wide diversity of knowledge across the whole healthcare innovation spectrum and I'm going to kind of draw from Tanya on that Health Innovation Hub, Tara clearly on the industry side, and of course Marie from the whole digital health side, the whole HSE side, in fact, a very broad spectrum. So thank you to all our panelists, and thank you, Dan, for setting this up. Now, I suppose one question that comes up is in Ireland today, we've seen changes, we've been challenged, clearly, as we know, but is there a strong appetite for healthcare innovation or innovation within the healthcare setting and from healthcare perspectives? So the world seems to have changed, but I just want to get sort of an on the ground feeling for that right now. Any of our dignitaries have a view on that?
I'd say we can all answer that one.
Coming in?
Yeah, so I suppose, Dan, if you want to take it from our perspective, so we're an organization that deals both with industry and the healthcare system itself. And in terms of the appetite for being involved in understanding and assessing innovations, we have a hugely involved healthcare system. Over the last number of years, we did an assessment there. We had over 800 companies in Ireland come to us with innovations. But then in terms of bringing those out into the healthcare system and getting healthcare teams to either feedback, understanding the innovation, wanting to know how it could impact them in terms of problems, there's huge engagement. And we are really lucky in Ireland to have an engaged workforce, and that's growing and growing. And so they're now, one of the things you'll know as well is that within a number of the hospital organizations in Ireland, they've put in innovation leads, and that is just fantastic. And it's really a growing space. So there is a huge appetite, and it's not going anywhere quickly. So that's good.
Very good. In fact, before I just switch away from that, Tanya, you were talking about 800 companies, but it's, from my understanding as well, there's many individuals who approach you directly, not just. I think it's important that everybody can see. Do you want to comment around that?
Yeah, so there's two angles to it. One is that people just wanting to be involved in innovation, and then the other side of it is what happens now with us is that we see a lot of people working within the healthcare system or close to the healthcare system. So in industries associated with it, coming in with their own ideas, and really kind of needs-driven development of those ideas is where people are getting involved now. So to be honest with you, if I give you the numbers on that, they're flabbergasting. We have 500 ideas that came in from healthcare staff alone. So, I mean, if you think about that for the small country that we're in, and a lot of people just have the ideas, but they need a team to work with them. So innovation will often need lots of different disciplines. So there's just a huge appetite out there. It's a great time to be involved in this space. So it really is. The next few years are going to be, I think, if we watch what's coming out of Ireland across the spectrum in the healthcare space, we're going to see a lot of activity.
Very good. Thank you, Tanya. Now, I suppose we all know, but how has COVID-19 really changed the healthcare landscape? Has it been for better or for worse? And can we build maybe on some of the positives that have been emerging, maybe from the pandemic going forward? So I'd certainly open it up for that, but I'm kind of looking a little bit towards you, Maria, on that one, just from that whole perspective, and certainly look forward to your perspective on it.
Yeah, thanks, Dan. I agree with Tanya. I think the appetite within healthcare is huge for innovation, and it's become through COVID much more of a normalized thing for people to actually bring into their business as usual. It's how do we problem solve? So if you take even the word innovation out of it, it's like, how do we solve the problems that we're facing now? And a lot of people in the HSE have had to do that constantly through COVID. Just every time you thought you had actually solved the problem, a different angle came in and you had to look at it again. So the culture of innovation was really embedded within the environment within the HSE, with people maybe that found it a little bit more difficult to change. There was no choice. We had to jump on board and really get to it because the old wasn't working and we had to find new ways around things. So COVID has impacted innovation and problem solving hugely, and the opportunities that people can see. And again, I think, and Tanya will have seen this as well, it's the fact that you were able to actually make the changes and see the impact very quickly, tangible impact very quickly with the innovation and the problem solving, that people then felt more confident that I can do this. It's not, and innovation isn't this shiny object up here that is something that's difficult that I don't know how to do, and I'm not sure of all the different business models and processes, which you guys at Trinity are brilliant at teaching. But they sort of went, we have to try it ourselves and really get stuck in. COVID has been immensely powerful in that space, I think, for us all in the HSE.
So it's been very catalytic. Actually, just Tara, on that, just from an industry perspective as well, and just kind of broadly, what have you sort of seen with respect to maybe the impact? Because certainly from Marie's side, it has been absolute direct impact. But from the industry side, I'd be very interested to hear your perspective.
Yeah, like COVID-19 has completely changed from an industry perspective, because what was probably a very traditional type of industry, and there's a lot of like incredibly well-respected people. Like I work for a company that hires some of the best people in the world, but they have quite a traditional mindset. And COVID really made us pivot and say, like, can we do virtual trials? What about digital health solutions? What about more health management? What about treatments rather than drugs? And then there's things that have been introduced, like Amazon Pharmacy, all of those other types of competing, the competition that's come into the industry. Right. Actually, at the same time as COVID, it has made us really speed up and adapt. So it's one of the things that we are really focused on is like, so kind of linking back to the first question, there's a huge appetite for hiring people with innovation experience. And sometimes you see in large industries, lots of people with innovation in their title, but then what does that actually mean? So there's a huge piece of work done around like skills mapping, capability building, experience for innovation that probably hasn't been done before, because it was like, oh, this person's quite clever and they come up with ideas, or they can optimize something. Now they're innovative, but this is real. We recognize that this is a really tangible thing. So we need to get more innovative people.
Okay, so it's interesting. So from an industry perspective, it's not just sort of observing what's happening, let's say, outside the walls. Literally inside, there's complete sort of catalyzing and rethinking as well from what you just described there.
Absolutely, like testing. Something that, you know, because the nature of the industry, it takes a really long time before you do anything or you put it out in the market. But actually testing small things is a really, not from a drug perspective, but from a like digital health solution perspective, ideas. Right. What's the smallest thing you can do to test?
Rapidly, very, very good. Listen, actually something that applies to every one of you there is whether you've seen success stories because of innovative solutions, either product or service or a care pathway that is going on. So I'll just totally open it up and sort of, if you can pick your top one or two sort of ideas, they said, look, they would be interesting to get across what actually happened there, and how this is kind of, this unknown kind of innovative element has somehow triggered something new. So Tanya, can I hand back to you? Clearly, as you said, you've got 800 plus.
I mean, I think the one, when you listen to both Tara and Maria there, I think what COVID allowed us to do is we had the freedom to innovate, in whatever way you use that word innovate, but we had the freedom to take a few chances, try and solve a few problems, maybe just kind of push the envelope a little bit, but actually the results have been phenomenal, and that's what's happened. There's now the freedom to do things, to try things, and it's become part of the culture. So it's now the norm to kind of make that step, and it's okay to be excited about innovation now, whereas sometimes before it might be they're a different breed of people, we can't really get involved with them. Now it's there, it's out there, everyone's talking about it. So in terms of success stories, and you know, Dan, I'm always about needs-driven innovation. So what's the need, what's the problem, and let's solve it. A couple of examples during COVID would have been, and these are just very simple little things, but like you'll have all heard about the issues related to partners visiting during maternity visits. And that also applied in cases like where there were long-term patients staying in hospitals that did, you know, elderly patients who've been in for a long time, and their only kind of respite during the day was visit from their family members. But COVID stopped all that initially. And what happened was we had two hospitals coming to us saying, look, we really need, our staff are miserable because their patients aren't seeing their family members. So we worked with a company, a Limerick-based company, and it's fantastic that the Irish companies can provide these solutions. And because they were so close, they were able to go in, see what the problem was, really drill down to that problem. What's the issue here that we're talking about? And that company, they're called Yellow Schedule. They developed a system where basically the patient could nominate a visitor. The visitor was pre-screened for all the COVID regulations. Then they were able to pick a time, and the times were allocated based on minimizing the number of people in a particular ward. So all those restrictions were taken into place, the constraints. And then the nice thing about it is once they had picked their time and they were all ready to go, they were sent a barcode, and there was a barcode entry through the hospital. So they didn't sign in, they didn't congregate in any one location. And then they were sent a text message when their time was up so that there wouldn't be a kind of an overlap of patients. Very simple, but actually there wasn't a solution in place, and it worked. And the impact on staff and the impact on the patients and family members was phenomenal. So they're now keeping that in place for all visits so that it's managed in a good way that way. And the same thing happened in the maternity hospital in Cork. They used that to manage the footfall going through the hospital. So simple example, Irish company, didn't require huge innovation. It just required people to work together to try and solve the problem. So yeah. Okay.
Very good. And Maria, as well, you must have seen a lot of different kind of examples in front of you, but are there any you'd like to highlight?
Well, like even as Tanya's saying there, like it's the simple problem solving that make the big impact to the people. And that was for us, it was how do we help basically people within the HSE going through the COVID crisis as well. And there's one, I'll hit on one even just from personal experience from the learning side of things as well, which would support what you guys are talking about. And then I'll hit on one from the health identifiers and what we did in there just very briefly. So with the learning side of things as well, it was a big shift for a lot of our workers to go from being in the office to being at home. Most people didn't even have laptops at home. They were office-based fully, that's it, full stop. So how do we move? I had to get our finance team home to buy PPE, our HR guys home to actually recruit staff, and our procurement guys home to actually source the PPE. And they were all in-house working on the systems internally. Whilst doing that, what came across very clearly was the fact that people were concerned about the change of working from home. So that was a complete change to them. It wasn't actually getting their technical equipment home, which we did very successfully with the OCIO. Very quickly, they were incredible. It was, how do we use this? How do I work like this? What does this look like to me? It's a complete new system. And what we found throughout the entire HSE, with lots of people having to go home, the moved remote working, the change element of how they did that from a hybrid perspective was massively impactful on them and how they did their business. So collaboration, as Tanya talks about as well, it's actually working with other organizations. We worked with a few different organizations, and a remote learning course was brought together within 6 weeks. And we actually walk people through the cultural aspects of working from home, from a cultural perspective, from a technical perspective slightly, Over 2,500 people registered for it within, I think it was like 5 or 6 hours, from admin to surgeons. And it was gobsmacking. We didn't expect it. We were flabbergasted. We thought we'd maybe get 500. And we graduated them by the June. And we had Michal Martin graduated the team. It was the largest online graduation because people needed support from the cultural side of change. How do I do my job? How am I able to actually function in this new world? So innovation from that problem solving was massively impactful, and the testimonials of how we help people huge. So really important around that learning and development across all those innovation stages within that culture side of things.
Okay, so it's been accelerated learning and deep accelerated learning across all. The other thing that comes out there, and certainly Tanya would have mentioned, and I'm coming to you on this one now, Tara, as well. It looks like innovation, rather than it being a kind of a top down and the ideas are at the top, or the ideas are in the middle, or the ideas are at the bottom. It looks like once the kind of whistle was blown to say stop, everybody, because of COVID and work from home and so on, it seems that innovation has percolated at all the levels, and that the ideas have come from all levels, not just a directive. Would that be true, Marie, on that? Yeah, I'm just back to you because you
100%, because with COVID and also with the cyber, like you had to make decisions with the organizations you were in and the departments you were in, and it was, you had to move quickly. So a lot of the time it was quick moving decisions. And it was all levels, which was massively important. I'm sure we all know ourselves. It's about the people who are in the weeds. Anything we did in the health identifiers, it was actually talking to our guys that were working on the identifier systems. What were they seeing? What was the themes? What was the data? It was about the ground feeding up the information for us to be able to make changes and change what we were doing from an innovation perspective and solving the challenges as well. It's very much.
No, thank you on that. Sorry, Tara, I got deviated back there because it was so intriguing, but I wanted to come to you on the industry side as well, on the two parts of it. Have you seen maybe examples that you say, yeah, these are concrete ones? And also that question about the level, was it a sort of a top down, was it a bottom up discovery, or was it just pervasive across the whole organization?
It's really interesting because when I was thinking about, questions and what I'd say in advance, I was like, Maria is like this, they take the T-cells out and put them back in to try and cure cancer in kids, and like incredible innovations. And I was like, that's what we do. But actually listening to Maria, where the real, that is innovation, but it was happening for a very long time. But where the real optimization and improvements happened is like on a day-to-day basis with everyone in the organization. Because for the first time ever, people that are super, so I have a perception, and I think Maria, you might have seen this as well, that a lot of people in medicine and like maybe pharmaceuticals, or people that have to be very high achievers, they tend to present things when they're ready, right? So it's like, it's a real challenge to get people to show you something half-baked and give them feedback, because they want to say, this is it and it's done. But it made people have to solve challenges on the fly, pull some prototypes together, test them, figure out that it wasn't going to work, and iterate. And we were all doing that at every level. So from like a finance meeting, or an actual meeting that we had that was completely virtual, or when we started to come back to the office and I was running week-long workshops that were hybrid with 6 people in the room, it was like, this isn't working, let's iterate. We need to come up with something really quickly. So from every level, people were really changing their mindset and seeing it work in practice quickly, which I think was a real pivot.
Okay. In fact, you mentioned a very intriguing word there, which was hybrid, because what we've already discovered, all of us involved and those involved in the education side, we understood the sort of amphitheater, sort of Greek amphitheater aspect of it. And then we've grown and understood this sort of broadcast sort of one to all out there in cyberspace. But the hybrid one, where you got some people in, some people out, half in a class, half out, is yet it's a work in progress, I would say, from many on the academic side. But even in industry, how did you find it, Tara?
Well, I came from a humanitarian background, so I spent a lot of time working remotely with Teams, right? So when this came along, I was like, oh yeah, I'm the expert, I've got this. So people were coming to me. I was writing, the virtual collaboration edition for the whole organization. And I was like, I've got this. And the second I felt like I had it, we went hybrid. Like, it is completely different. And the self-awareness that the people in the room need to have in order to bring in the people outside and making a full day meeting, 3 hours, but the people that are in the room want to have the chats. It is, I absolutely have not cracked that yet.
Okay, it's a work in progress.
It's a work in progress, yeah.
But anyway, in terms of the innovation agenda and the excitement around innovation, it sounds like the kind of the rapid testing, the rapid prototyping, the agile response that you talked about, Marie. In fact, what you really talked about was cultural change, more or less. I wouldn't say being forced, but being sort of reborn because of necessity and so on, the way you described it there. Tanya, are you seeing anything on the sort of overall horizon that where these sort of success stories are coming, and not only are they sort of proving useful, they actually are going on to form maybe a whole new domain or new company, or something has really arisen just beyond, let's say, the immediacy, and actually now you think may be sustainable?
Yeah, well, I mean, I think COVID allowing people to take chances and to actually make those small little changes made them realize they can make bigger changes, and they keep going. So I think one of the things we found, and I don't know, Maria, if you're part of this kind of activity, but we all know that waiting lists are a big issue in our HSC. They're the same around the world. We know that. But what we found is, say, if you take, in working with our healthcare staff, we found that a lot of them have solutions to elements of that. So waiting list is a word we use, but there are so many different parts of the waiting list problem that have to be addressed. Some of it's the quality of the data. Is everyone actually on a waiting list? Down to things like, if you have a waiting list, can you triage the patients so that the critical ones are seen and the ones that aren't critical are put on some other intervention program that minimizes the impact? And if you take, for example, there's two projects we're involved in at the moment. One is an orthopedics project, and the other one is OT for pediatric waiting lists. So we all know that there are huge waiting lists for pediatric intervention in OT. But the problem with that is, if you keep a child on a waiting list with no intervention for too long, it becomes too late. The intervention doesn't work as well as it could do. So we're working with an Irish company. She was an occupational therapist. She saw this as a problem and wanted to address it. So it's a company called My OT and Me, very small Irish company, but basically they've gone with identify the patients that need to be seen immediately, and the ones that could benefit from at-home intervention. You send them a kit, their toys, their little things that they play with. The parents get involved in a training program, and they do online courses. And what happens in a lot of those patients don't need the intervention event by the time they get to the top of the waiting list, because they've been dealt with separately. So that's sort of looking at a novel way of intervening, so that we don't do the traditional waiting to see the consultant or whatever it is. The same with orthopedics. We're doing a program down in Kerry at the moment with another Irish company. The consultant is convinced that 50% of the people on his waiting list, if they got physiotherapy earlier, would never need to go for surgery. So can we find a way to use technology to triage the patients using AI, using data? These are all things that will come in the future. Can we use AI and data to triage those patients and put them into different sets? Can we give one set of patients an intervention from someone like an occupational therapist or a physiotherapy? And can we send the other ones to the consultant? Because we know they need to see them. They're kind of, but it's getting lots of different groups working together. And I think while we're not there yet, it's going to happen. It's going to happen in the next while.
Well, look, now that we've lived through the kind of the change world, and I don't innovation, not just about COVID, but COVID has certainly triggered a catalytic response. But at the same time, throughout this period of time, let's say 18 months and so on, 2 years, this sort of period, the question now becomes, how will we now foster innovation in the healthcare system going forward? So even if COVID hadn't happened, we'd be asking this question among ourselves: how will we foster innovation? I think COVID has loosened, this idea of sort of unfreeze and then refreeze. We don't want to refreeze too strongly though, but we've sort of got a kind of things sort of loosened up right now. So I suppose my question really to all of you really is, how would we foster innovation within the health service, and what kind of skills are going to be needed for the future? I'll start with you, Marie, at the same time.
Yeah, no probs. Just Tanya, I love that story. Sorry, I'm going to sidetrack to that one. That's amazing to do that with kids. It's absolutely incredible. It's things like that are massively impactful, and the waiting list is a huge thing that we'll be getting involved in as well. But it's things like that. I think it's actually telling stories. So Tanya's just told a story, and I'm in as a mum, and I'm there going, oh, and my heart is going, I get it. And I think to foster innovation is to show the problems we solved and show the impact they actually have on patients. And I think as well, like, this is my opinion, but I do think that the culture of maybe fear around problem solving innovation is starting to lift, and we need to grasp in where that's at the minute and teach people that it is about learning fast, not failing fast, learning fast. What we're doing, we're iterating, we're learning, we're just keeping going, and everything we do is making a positive impact. For me, to foster innovation, I think would be to do what Tanya's just done, tell a really impactful story about how the changes have actually impacted, like I'm getting goosebumps, have impacted kids. That's incredible. That's how you foster innovation, really showcase what the impact is. And I think that will get people feeling that they can do it themselves, and getting the people that have done it, who maybe would be like, I would never have thought of doing this, and I did it and it's made an impact. I was scared to bring my idea forward, to get them to say, this is how I came across with the idea, this is how I learned how to do it, and the collaboration surrounding that. Love collaborating with people, bring as many heads together, because none of us have the answer. I think that's the best way to do it.
Excellent. Okay, Tanya, now obviously storytelling as you've done, but there are so many stories to tell. And your point, I think, Marie, about even people who are concerned, who are afraid, who are maybe reticent to bring their ideas forward. I think that the landscape has changed a little bit to kind of make it a lot more open. Yeah. And we need to continue to encourage that. But back to you, Tanya, sorry, on the factors for the future, or even if we've got this far, what would be the next steps or your suggestions for improvement in the longer term?
Yeah, I mean, a lot of what we do, a lot of the stories we tell, Maria, are small local kind of based stories. But I think if you get, I'm going to call them a network of people who want to be involved in innovation, that might take something that's happening in one location and mirror it in another location, so that you see the impact across the whole spectrum. I see one of the comments kind of from the panel, or the people listening to the conversation, is, okay, so that nice story about the barcodes down in 2 hospitals in Cork was great, but it didn't distill out to the whole country. And I suppose one of the things I'd be kind of looking at is, can you create a network of people who are passionate about healthcare innovation, who are working in that space or educated in that space, and want to bring and support those ideas across the country? Then we will impact more people that way. So for me, it's that network and alumni, and I think that's really important. And that ability to just not fear picking up the phone and talking. No one is an expert. No one's an expert in this space. So we're all, if you're trying to solve a problem and the problem exists, you're not an expert in that space yet. So yeah. I think that the issue is, can we get people to talk to each other and have forums like this, multiple kind of discussions, bring all the different knowledge and ability together? I think that would be huge in terms of having a really big impact. We'll have new companies starting, but we'll also have people within healthcare creating solutions, working with the likes of Maria, bringing in the companies, the big companies from Tara's kind of expertise, to say, how can we take problems that you've solved in big industry, apply them either to small industry, or use small industry to bring them into the healthcare system? So it's really that connectivity that it's starting. There is a sort of a groundswell at the moment, and I think that's, again, I'm very optimistic, but it's going to happen, and we need to keep these conversations going. So the more people that do these programs, the more people we'll have in that network and that grouping. And you know yourself, Dan, there's a couple of people that have been on the programs that are innovation leads in the hospitals, and they continue that discussion with their teams.
No, in fact, on the education side and on the workshops and on the certificate that we're certainly talking about here, and the diploma, which I'm also involved in, but certainly on these. In fact, I think one of the proud things we have is seeing people go back into the healthcare system and become, I suppose, not just ambassadors, actually catalytic motivators themselves, who then can break down the barriers that Marie talked about and sort of then deliver the stories that you mentioned, Tanya. So we're certainly seeing a lot of, but it kind of brings up the question, and it's kind of maybe a final question before we open up the panel and just ask you all, and I'll start with you, Tara, as well, is, are there barriers to this? You know, the way sometimes we and you've outlined a very sort of rich landscape, Tanya, there where we are seeing, and there's no question we've seen a groundswell, but are there barriers as well that we're seeing or worried about? And maybe an industry might be less barriers, but still I'd be interested. Tara, what would you be seeing on the, you know, not just the factors kind of bringing forward, but concerns you might have as well, that barriers could sort of prevent it, or we could refreeze, let's say, in a new normal, but maybe not the way we'd like?
I probably have three main barriers. So one of them is pretty much what Tanya mentioned. It's the doing things in silos. So, you know, this big industry does this and it solves this problem. What about speaking to an advocacy group? What about speaking to local health systems? What about involving patients at the beginning? So actually that whole process of, have you asked the patients? Do you understand what the real problems are? Or are you just trying to solve something that will, you know, reach a profitable target? And you can see that happening quite a lot. In my organization, we're definitely moving towards actually bringing in patients, connecting with startups, connecting with healthcare systems, working directly with patient advocacy groups. But it's almost like not a go-to. When somebody says it, it's like, you know, oh, that's a really good idea, but that should just be habit. It should be part of the process. And the second is the type of people that are innovators. So I think it's a really interesting challenge, because people say like, oh, that person comes up with ideas all the time, they're an innovator. Oh, great, that's the type of persona that we need. But actually, the problem that Tanya just presented, that innovation isn't going to scale unless we've got people that are super good at operations, and they're super good at communications, like Maria said, to tell that story. So it can't be just an ideas person. And I am guilty of being that, ideas after ideas after ideas. I know where I'm useful and I know where I'm not. So that's another kind of piece. It's about getting the right people involved at the right time. So because innovation is a process.
Anybody who's been on the courses that we've been running, I will know that the mantra has been that ideas without action have very little value. So it's the taking action on the ideas that absolutely counts. But, you know, the good thing about taking action on the ideas is that, in fact, it may not be your idea. It's just a good idea. But it's the one taking action is really creating the innovation and going for it. I'm not suggesting you're stealing ideas. I'm talking about taking action on the ideas. So even some of the ideas people, I think, as you pointed out, Tara, are not, maybe they're not taking action on their ideas, but they might be explaining them, and others could sort of actually use it and initiate it. But I wanted to come to you, Maria, on that same question of barriers. Are you seeing barriers, or do you have concerns for the future?
You know, a mad thing is that before COVID, I wouldn't have sort of even said this, but even from my own department, what I'm having to do now is say, okay, we need to slow down. We actually need to slow down a tiny bit, because we've been running at such speed, reacting to all the stuff that happened in COVID and cyber. And we've fallen victim to that technology will work, let's use it. And it's a technology that we're able to use, and we basically shoved our challenge or our problem into a technology without doing the engagement that Tara spoke about, looking at the design, the specification. And I've had to say to our guys, okay, now we need to actually slow down a little bit and go back to basics, engage with the right people, go across the departments, interact with the right stakeholders, and slow things down a little bit, because people have that appetite. They're excited and they can see the benefit things can do as well, but we need to do it the right way and the right processes. Look, a barrier for us would be around it's a barrier, but it protects us. So the procurement processes for us to actually engage with healthcare innovation. There is no point in me pretending that they don't exist, because Tanya really knows that they do. They're there to support us as a business enabler. That governance is there to protect the HSE, to protect the citizens, but it does make things a little bit maybe more longer, protracted. But it's important to keep that engagement with startups to really try and move that forward, especially in the startup arena. The larger organizations find it much, much easier to engage through those procurement processes. Okay. Seeing somebody popping up their recruitment. Oh, yeah. I could go on all day, and I won't.
No, I think Dan, sorry, just back Dan, I think it would be great to open it up to, certainly open it up to the panel with full level of questions. I don't know who might, Dan, whether you've sort of picked up them there.
So actually, I mean, we've got very good turnout this evening, Dan. Quite a quiet bunch so far, but a couple of.
Well, that's because it's so exciting, Dan.
Indeed, everyone's enthralled and engaged. A couple of comments just in relation to the types of barriers and querying whether geographical and recruitment barriers are an issue related to the earlier point. So I'm not sure whether anyone would like to comment on that specifically.
No, I think it's very important, actually. I can even partially comment myself on this, that we found that when we were running, you know, there's two parts. Running workshops, we often brought the workshops out to hospitals around the country, and that works very well. When we were doing them only in Dublin or central locations, sorry. When we designed the certificate, Dan, and you were the sort of one of the absolute key initiators, we decided to go, COVID forced it obviously, to be online, and that allowed us to reach into Donegal, that allowed us to reach into Clare, that allowed us not just obviously to reach into Cork and into Kerry and so on, Wexford, and clearly Dublin's, the Midlands, and so on. But we actually found engagement, and I was delighted that we could actually, the outreach worked easier. That's just on the education side. I don't know whether there's other geographic barriers that people might want to talk about, but certainly there. Dan, were you picking up an additional aspect to that question?
Yes. So no, not. I think you kind of addressed it there. It was quite brief, just in terms of how it was asked. And I think actually Tara has addressed it in the chat as well. We also had some specific questions around the course, which I will answer in the chat, but also borrow a couple of minutes at the end, Dan, to talk specifically on the detail of the course as well. Address those in the chat as well. So I'll just reiterate and invite anybody, any of the attendees, to drop questions in the chat, and we'd be happy to pick them up now. Yeah.
I think Maria has her hand up.
Just looking at the time, actually.
Can I just jump in just one thing around the recruitment? I just want to even clarify what I mean by that as well. I know that there's a few people saying here it took them a long time to get registered. The recruitment side of things as well, I know that there's the process with the HSE, but for me, it's actually skills, guys. So we're recruiting at the minute quite rapidly. I went from 3 on a new team that was developed when I started to over 30 remote onboarding people in COVID. But it's the skills, and this is why this course obviously is really important. I'm finding it difficult to find the right skill sets from a recruitment perspective. Now, this isn't only us, this is global, and it's going to be global, but just to be really clear, it's the skill set from the recruitment that this kind of course will support as well, that I'm speaking about. It's going to be a big problem.
Can I echo Maria as well? I'm finding it, I'm trying to hire a few people right now, and I'm finding it incredibly difficult to have very tangible innovation method experience versus I have been innovative in my company. Because if you scroll through LinkedIn, I'd say 90% of people have I innovate somewhere in their CV, but actually delving into that and really understanding like the methods that they know, how they've applied them, how they can support others to apply them. And one of the key skills that I think is really in need, especially with this kind of like remote hybrid situation, is facilitating others to be able to go through an innovation process, which is something that is incredibly difficult, but incredibly valuable, and everybody is really, really in search of that. So that's a skill. If you are a natural facilitator, I would highly recommend learning some innovation methods, and you will definitely have a role very quickly.
Give Tara a call. your recruitment drive.
A bit desperate. Yeah, I know I am looking for somebody else.
Do the certificate first and then give Tara a call.
Exactly, Tanya. Yeah.
Well, you've raised a very interesting point there, Tara, because the original objective was very clear, because within the HSC, you have up to 100,000 people. We always knew there was a lot of innovative people inside, but I think there was kind of a feeling that they might have maybe had more difficulty releasing their innovative energies and so on. And COVID, obviously, as we said, made that a little bit easier. But the whole idea was to take people, and Tanya knows this better than anyone, in the Health Innovation Hub, which was like to allow companies, external companies, I'm talking about real existing established companies, to approach the health service and act as that conduit in, then to allow the people inside to bring out their ideas and sort of bring them back, and then clearly to educate everybody at a groundswell up and get a response to allow them to go back in, not as Trojan horses in the negative sense, but as Trojan horses in the positive sense, to actually sort of instill action within their organization. And that was the original ideas. And that has been working quite well. We've been very proud of what's happened so far. And I know Tanya, over the last 4 or 5 years, and I've worked on this with her and the teams and so on, and through the HSC and the digital side and many sides, we've seen a lot happen. But what you mentioned, Tara, is something different. It's in that sort of changing space. There's a need for facilitators, idea managers, people who understand both sides, to kind of just lubricate the whole thing to make it flow better. And so there's a whole new career in sort of like facilitation, although we might find a more exciting word for it. We need to think up a more exciting word for it, but it's critical for the future. So thank you for that, Tara. That's a very good idea. Of course, you're going to lead off on that, Tara, so we're looking forward to writing the book on it.
Yeah, that will be my next job. Great.
And I might come in there, if that's okay, just to say that we're almost just at time. I don't know if there's any kind of last comments before. Maybe I might just say a few words about the course before we close.
Over to you, Dan.
Is there anything you'd like to cover? Okay, super. Thanks, Dan. Thanks very much. So just for our attendees this evening, I just would like to give a little bit of information of the course itself. So this is a postgraduate certificate in healthcare innovation. It kicks off at the end of March. To be specific, Friday the 25th of March is actually the first day of the course. It's currently open for applications. It's a 30 credit, so that's 30 ECTS PG Cert at level 9 on the National Framework Qualifications. It's spread across 3 modules. The first module is Innovation and Creativity in Healthcare. It's a 10 credit module. And that module really explores things like the principles and practices associated with creativity and innovation. And it gives participants on the course sort of exposure to frameworks and methodologies around things like idea generation, problem solving, and design-led innovation in a kind of healthcare context. So really good for getting the creative juices flowing and sort of thinking about things a little bit differently and thinking about how we can apply the principles associated with innovation in that sort of environment. And then module 2 is a little bit more focused on opportunity generation and recognition. So how do we get people thinking a little bit more with that entrepreneurial mindset? How do we help people sort of recognize and exploit sort of potential for innovation and opportunities through that? So there's also a focus there on how do you articulate your ideas. So if you have ideas for improvements on process or policy or product or service, you know, how do you go about articulating that in an influential and accessible way? And then the last module on the course is enterprise development, and that's really looking at, well, how do you get buy-in for your ideas, and how do you also then potentially look at getting funding for them, be that within an organizational context or be that within a kind of entrepreneurial context. So there's sort of 3 focuses, 3 lenses through which we look at healthcare innovation on the course. It is delivered, I should say, very important to mention, in collaboration with the School of Medicine at Trinity and also the Health Innovation Hub Ireland. A couple of questions that came in on the chat just around, you know, further information. Please do feel free to contact springboard@tcd.ie, and I'll leave that in the chat. Should anybody have any follow-up questions, if you'd like to apply for the course, you can go directly to springboardcourses.ie and you can apply. If you do a search for healthcare innovation, the course will come up for the March intake and you can apply directly there. In terms of the eligibility requirements, we are seeking applicants that have a level 8 qualification. So that's a level 8 honours degree. There is a recognition of prior learning, so people who have worked in the industry for a number of years that don't necessarily have that qualification, they're also welcome to apply and will be reviewed under the recognition of prior learning policy. The good news is that the course is, it's 100% funded for eligible applicants and 90% funded for those who are currently in employment. So that means you really will only find yourself paying a very, very nominal fee of about €380 for a postgraduate course in healthcare innovation. So it's a really, really good opportunity. Places are limited, so I do recommend that if somebody has an interest, please do follow up with us directly via springboard@tcd.ie. We can talk to you more about the course, but we can also help you get started with the application process. So please do reach out to us if you have any further questions in relation to the course whatsoever. A question did come in on the chat about how the course is assessed. And I always think that's an important one to address and call out. This course doesn't have exams, so it's not assessed in what you might call a traditional format. It's very much continuously assessed using a combination of assessment methods. So through things like project work that's done in conjunction with project teams, also reflective practice, also report writing and pitching and articulation of ideas as well. So a variety of sort of assessment methods that help you sort of, as mentioned, articulate your ideas and do so in a sort of convincing way. So yeah, not your traditional sort of approach to assessment, but something that's very much team-based and multiple opportunities to sort of to progress through the course. So any further questions, please do feel free to reach out to us directly. I'd just like to say very much thank you to everybody this evening. Particular thanks to Maria, to Tanya, and to Tara for joining us, and thank you to Dan for chairing. It's been a really, really enjoyable and engaging discussion this evening, and I look forward to catching up with you guys again in the near future. So thank you so much. Dan, would you like to say anything to close out?
Yeah, yes, well, thank you very much, Dan. No, it's very interesting and it's very enjoyable to have our discussion with sort of people who are literally in it. But Tara, we never even called on you, because usually if we have somebody who's done the course, we sort of call on them and they sort of say, was it hard? Was it tough? How did you get through it? So can I leave a little kind of word to you on that, Tara?
Yeah, I actually wrote a bit of a kind of like blurb in the chat, and I'm dyslexic, so that's why it's all messed up. But it was like, honestly, it didn't feel like a course. It felt like it felt like hanging out with like new friends on a Saturday that you have this kind of have all these new ideas with, and people actually worked through their own ideas, so things that they wanted to bring into their organizations through the course. So it felt like, or something that was like a bit of a side hustle that they wanted to start up. So you were able to bring what you wanted into the course and use the expertise of all of the lecturers to support you. So honestly, it was really, like, I won't say it wasn't easy, it was challenging, but in all of the brilliant ways, and you were supported. I just found it really fun. I think my husband, after the first weekend, was like, what were you doing? Like, you just look so happy. I don't understand. You thought you were in college. So honestly, I really enjoyed it.
Tara, you're making me want to go and do it now.
It's really fun.
Actually, you made a very important point, though, Tara, there that maybe we should articulate. Sometimes we get people coming into these courses who have no idea whatsoever, but they're very open. They really want to know about innovation. And then over the period, they'll come up with some ideas. Sometimes we get people who sort of have vague ideas, 2 or 3, and they want to progress them, and the course works well for them. Occasionally with people who've got a rock solid idea, they're absolutely clear on, in fact, they more or less tell everybody they're only doing the course to do this idea. And we've had two outcomes with that. Sometimes they really did go through with that idea. Sometimes they came through and actually decided, you know what, it wasn't such a great idea after all. And they sort of reformed and sort of done. So yes, to those who are worried that they don't have any very specific idea, I suppose I want to leave the encouragement there to say, as long as you're thinking along innovative ideas, and as we already mentioned, the idea doesn't really have to be yours, it has to be about taking action. And I think what Tara pointed out is collegiate action, as well as sort of getting down to your own. In the third module, it becomes very much your particular project, but over the first two modules, it's very collegiate in that area. Sorry, Dan, thank you very much. You shouldn't have asked me to put final words in there because I extended, but can I call on everybody just for maybe one final word? Tanya, can I open it up to yourself?
Yeah, I just think, look, if you're anyway interested in this, go for it, because it's a relatively short course. And as Tara said, you're going to have fun when you're doing it, and the outcome can only be good.
Okay. Marie, from yourself?
Yeah, I even echoing Tara's comments around the like-minded people that you meet, and it drives you and it gives you the energy as well. So I think when you come together with those groups that Tanya spoke about as well, it gives you energy to keep going and people to bounce stuff off. So
Very good.
Highly recommend.
Thank you very much. Well, Tara, comment on it. Dan, you're running the whole tangent world there. Can I leave the final word to you to sign off?
Absolutely. Thanks, Dan. So what I would say to attendees is get in touch, start the conversation with us as soon as possible. Even if you're kind of vaguely interested and think this might be something, have the discussion with us. We're now in our third iteration of this program. We've seen a broad spectrum of people from the healthcare sector participate and be successful at the program. So we'd be delighted to speak with anybody who's potentially interested. But do start the conversation with us sooner rather than later, because time is ticking and the application process is underway and places are limited. So do get in touch. Yeah, thanks very much, everybody. Have a good evening.